And I have the pleasure now to introduce our next panel as we move on, and we're going to really dive in pretty deeply to election engagement. We're going to have the chance to see some new polling data, which is very exciting. We're going to have the chance to visit with some federal policy advocates, which is a good, insidery way to look at what's going on in the Beltway. So I'm really pleased to introduce you to Peter Mitchell from Marketing for Change, Bailey Rivas from Families USA, and Bianca Rogers of the CareQuest Institute for Oral Health. So Peter's going to kick us off. You can already see the slides coming up. He's going to kick us off by sharing the results of a very new national poll that found that voters overwhelmingly support, something shocking, or overwhelmingly support having dental coverage in Medicaid, Medicare, and for veterans. Immediately following that, we're going to have Bailey and Bianca share why it's critical for us to be engaging with candidates during this election season. And they're going to share with us a new toolkit filled with some new resources to take action. So please do check out all the bios for Peter, Bianca, and Bailey and Huva. They're all in there. And remember, if you have questions, use that Q&A box and we will get to those as quickly as we can. Thanks.
Thanks a lot. I think I'm going to start us off, and hopefully see if my buttons work here. Yes. Oops, went too far. So my name is Peter Mitchell. You can read my bio, but basically I worked on this polling for Open and CareQuest Institute. It is pretty extensive look at where voters are right now. And these are registered voters, not just likely voters, but registered voters, both nationally, and then we also looked at 3 states. And this just gives you a look at what we did when we did it. So it was really the beginning of June, very end of May, and then sometime in June, depending on which of the surveys. We surveyed nationally, Ohio, Pennsylvania, and Michigan. These were 12-minute online surveys and asked about Medicare. Then we did a message test. Then we asked about veterans. Then we asked about Medicaid. And the order of that matters because the earlier you ask somebody something, the less kind of influenced they are by previous questions. Oops, I'm used to my. Now, I want to talk about the sample a little bit. Any online sample is not perfectly representative. Any sample is not perfectly representative of the population, but especially online samples. We used a YouGov sample for the national sample. And as you can see, the younger group was a little bit underrepresented, as well as the 55 to 64, a little overrepresented. And then Hispanic population was underrepresented. This is an English language survey. So this is all what you would see in almost any survey. So when you read surveys in the newspaper or something, they would be pretty similar to this in how they're different than the overall population as compared to census. Oops. Keep pushing them. I got a bad habit where I push to change the thing. So let's talk about Medicare Dental. Medicare Dental, huge support. Now we did this about I guess 4 years ago, 3 or 4 years ago, and it was about 75% support. Now 92% of people agree they support including a dental benefit in Medicare, and you can see similar things in these battleground states that we did. Similar results, and 72% strongly support. So we do a lot of polling on a lot of issues. It's pretty tough to find an issue like this in today's America, but this is truly an issue that is popular in more than just one portion of the country or one type of voter. And here's where you can see that as it broken out. We looked at people that had supported Trump twice, 2016 when he won and 2020 when he lost. And 85% of those loyal Trump supporters were supportive of adding dental to Medicare. And 64, 2/3 of them are feel very strongly. I think as you're talking to, we really have these different ecosystems of information and of electioneering. And if you're talking to people in an ecosystem, in a Republican ecosystem, this is pretty powerful information. And then the support on the other side and the other ecosystem, just almost universal. This is, again, something that you don't see with very many issues at all. And these include issues you'd think that a lot of people agree with. Guess what? It's similar whether you go rural, urban, or suburban. Almost any way you cut this, it's really tough to find a difference because it's so overwhelmingly support. The support is so overwhelming. And here you see, some slight differences, but basically, even people that are the furthest away from Medicare, dramatically high levels of support. Now, this support also translates, as you're talking to candidates, to candidate support. About 60% of people nationally said that they would somewhat or much more likely support a candidate that pledges to add dental benefits to Medicare. So this is a positive, and it's certainly not a negative. So at the very worst, people there's a third of people that say it won't make much of a difference. But the amount, it's very few that would actually be turned the other way. So this is a super safe issue for a candidate. Now, looking at candidate support among two-term Trump supporters, a little bit less powerful, but still powerful would be imagined in a Republican primary. Still a net positive in a Republican primary. So these are all amazingly high numbers. And this is the beginning of the survey. So we know that people are giving us their more honest opinions. We compared the benefits, different types of benefits. This kind of, depending on the sample, can bounce around a bit, but dental services, nursing home care, vision care, always the top three. We've seen this vary. So I wouldn't put a lot of this horse race is going to finish differently depending on what you've been talking about earlier in the poll. But still, again, dental services on top nationally. We also tested messages. What's the way to talk about this that is the most persuasive to people, that makes them most likely to pick a candidate, one candidate over another? So what we did is we said, okay, here's 4 candidates, and here's what they're saying. Pick the one you're in favor of, or you'd be most likely to support. And the message that tested the best was this one: workers pay into Medicare their whole working lives. They deserve full coverage, including dental coverage. And the second one was, no one in this country should have to choose between getting the oral health care they need and putting food on the table. That's why Medicare should cover dental. Now, these numbers on the side, I won't explain the entire math because that would take the entire call, but I will explain this. The differences between them are significant. They're the actual amount of differences in preference. So on the national sample, the workers pay to Medicare their whole working lives was not only the top message, but it was twice as popular as the next highest. So that's a significant difference. And remember, even the negative ones, don't feel bad about those. This is how they competed with other messages. All the messages except for one were positive messages about Medicare dental. And there was one that said that they'd be opposed it because it would waste money. This looks at some of the messages that did not perform well. And this is because it puts it in a different framework. And so these are messages we probably want to steer away from. Medicare should not cover dental care. This is the bad one. Here's the negative one. That's what you should do. Shouldn't oppose it. And then leaving dental care out of Medicare disproportionately impacts Black and brown people. Let's fix this. Now, another way to say that is that same message that tested above, where we say, no one should have to choose. All of us should have the opportunity regardless of race, age, or gender. It's just a different way to say the same thing, and it tests better. And that's pretty consistent with other messages we tested on Equity Lens, that talking about a unified versus helping a particular group always performs better. This is, I thought, really interesting. So it depends on who you're talking to. And you may talk to a lot of different people in your work. And if you're talking to two-time Trump supporters, guess what? They're a little bit different than people that supported Biden and Clinton over those two elections. And but workers that pay into Medicare their whole working lives, they deserve full coverage, including dental coverage. Not only does it perform very well with Trump voters, it's one of the top ones for Biden Clinton voters as well. There are some exceptions of ones that are a little bit better. All of us should have the opportunity, regardless of race, age, or gender. That sort of equity message does better, not surprisingly, with the Biden Clinton voters than with the Trump voters. Most Americans lose their dental insurance when they retire because traditional Medicare doesn't cover oral health. Let's change that. Or covering every part of the body except the mouth, which doesn't make sense, does better with the two-time Trump voters as compared to the other messages. Doesn't say that those messages don't do well with the other side, just that they don't do as well as the others. Here's the point I was making before with the two different types of equity messages and how they do here in the case of specific, whether they're Biden Clinton supporters or two-time Trump supporters. I don't think this is shocking to anybody that's followed politics even casually, but just to know. We also looked, and this is a little bit, I'm not going to go through this in detail, but we'll provide this to you so you can look at, depending on the age, gender, race, ethnicity, people react differently to different messages. So it's kind of good to know, depending on who you're talking to, the preferences, and this gives you the preferences by that. And these slides will be available. I see that question come up. Yes, actually, I'm expecting you to have these all memorized by the end of the presentation here. There'll be a quiz afterwards. People really like that dental coverage for everyone, that all seniors, this whole idea of it universal definitely was more important to people. This was part of an open-ended response that was coded later, where we asked people, why did you pick the messages that you picked? Moving along, let's talk about Medicaid dental. Medicaid dental, you'd expect to have, well, maybe people aren't as supportive. There's a lot, sometimes it's difficult to sell programs that benefit low-income people. Let's talk about Medicaid dental. Look at that, 74% support. So not as much as Medicare, because Medicare is apple pie, but Medicaid, this is a lot of support for adult dental coverage under Medicaid. And as many of you, if not all of you know that this is not a mandated, although most people support mandating that states cover adults under Medicaid. This is, to me, was a bit surprising in the work that I do and what I hear. I do a lot of work on, how people feel about low-income people, and it's not always, depending on the population you're talking about, not always very generous. But this is a wow, yes, Gary. And again, it doesn't matter. Rural, urban, suburban, pretty similar stuff. By age, we see a little less for the older, and the very young are a little less supportive. That's actually significant, but it's not huge. It's still largely supportive in those populations. This, again, is one of those ones that can vary, but dental services compared to what vision care, hearing services, cosmetic surgery, weight loss programs, more popular for Medicaid as well. We didn't ask about nursing home care because, of course, nursing home care is covered by Medicaid. Veterans benefits. Now, here's where I did expect a lot of positive feedback, and that's what happened. This was not a shocker, but it was there. But 2/3 say don't only cover it the way you cover the rest of the health, just give it to all the veterans. So that's the more positive. It does seem, if you look at these numbers across everything, that there is a consistency here of people recognize that oral health is part of overall health. Kind of a dumb moment, but sometimes it feels when we're talking to policymakers when we're looking at policies, that doesn't seem to be the case, because the policies don't always reflect that attitude. And here you see the support, again, this support is pretty consistent in both of the two ecosystems, where you look at it, and heavily supportive. Translates to candidate support, now 66%. So once again, this is a safe thing. You only have 9% that you might lose. Look, you can gain a lot more than you lose. So for a candidate, this is pretty convincing stuff, for veterans. Okay, so here comes to the theme that we're going to be talking more about when you see the packets that have been put together. But you know, we asked people, when asked about, you know, how should we cover people? You know, and they could answer anything. They could put in their own answers. 79%, you know, 8 out of 10 say, you know, Medicare should be the way we cover oral health for older Americans. Veterans benefits should be the way we should cover oral health for veterans, and 71% say Medicaid for lower income adults. So, and finally, and this is surprising. Now, this came at the end of the poll. So this number is not as you've been asked a lot. By the time you come at the end of the poll, you've been asked a lot about Medicare dental. But even given that, look how high Medicare dental finishes against issues like Affordable Care Act, abortion, access to mental health, the opioid crisis. If you think about all these issues that we read so much more about in the media, and look how high adding benefits to Medicare falls. Again, it's a bit skewed because it came at the end of the poll, but still interesting that even after that it was able to finish that high. So that, and hey, guess what, Bianca, I actually came in under, so I'm leaving a lot of time for questions because I did go through that rather quickly. But really interested in your questions. And even if you didn't see something there, we asked a lot of questions and you want to know how voters feel. I'd love to answer those. I think, are we answering that? I think we're answering that after the,
Yeah, Peter, if you want to stick around,
I'll stick around. I always like watching
Perfect.
your first presentation. So
oh yeah, great. Building me up, thank you. Yes, so I know we just threw a lot of information at you. We are gonna send those slides over to you. But as Bailey and I go through our portion of the session, be thinking of any questions that came up for you. We got a couple of reactions in the chat box on just, you know, like we said, this has always been strong, but this is like the strongest we've ever seen this. So just as you're thinking about these and how you want to utilize them, throw your questions in the Q&A. But first, we're going to turn it over to Bailey, who is going to talk about why it's so important for us and for advocates to be engaging throughout this election season. So over to you, Bailey.
Yeah, hi everyone. For those who are not familiar, my name is Bailey Revis. I'm a manager of government affairs at Families USA and am leading our oral health care work. You might be wondering, like, why are we talking about, I mean, we're always talking about oral health, but why are we really emphasizing it within this moment, going into the summer, and of course, going into the fall and the election? And if you want to go to the next slide, the reality is that now through the fall and the election is just really an important moment to be having conversations about oral health, about improving and expanding oral health care with elected officials and candidates specifically. And there are two main reasons why bringing this up during an election season, during the summer, when elected officials are back in their districts for August recess, are really important times of the year. And for elections, they only come every 2 years, you know, more or less. So these moments are specifically ones we want to seize upon for two main reasons. The first is that, you know, it's a really key opportunity to be lifting up agendas and priorities, and a key opportunity to build champions on these issues. This moment in particular is extremely important because two of the biggest voices in the Senate on oral health care are retiring: Senator Cardin from Maryland and Senator Stabenow from Michigan. Those are two open seats now, and so those are members that have routinely introduced legislation in the Senate. You know, Senator Cardin hosted the first oral healthcare specific hearing in this Senate Finance Healthcare Subcommittee. So these are folks who have carried a lot of energy and momentum on this issue, and it'll be really important to rebuild those voices and those champions in the Senate, and elections are a really key opportunity to do that. It's a great moment to have new folks speaking out on it and willing to take this up. Importantly, these are moments to be able to get folks kind of on the record or talking about things. They're making a lot of conversations about what their agendas are going to be and what issues they're going to prioritize in the next Congress. And so that is why it's a really great moment to build champions on this, because now is the time that elected officials are going to be talking about what the next 2 years can look like. And so having them talk about oral health or getting oral health in front of them really creates an opportunity for them to become a champion on it in the next 2 years. And additionally, you know, we have some valuable champions currently in the House of Representatives, specifically Representative Berrigan from California is a huge champion on this issue. But, you know, there are 435 of them. And so just increasing those numbers and getting more folks interested in co-sponsoring or sponsoring new legislation is always really important as well. And then the second point about why elections are such important times is because I kind of mentioned this, but to dive more deeply into it, for folks who are running for office, particularly for folks who are running for the office for the first time and don't already have a set agenda of things that they have typically worked on or that they've championed in Congress, now is a really important opportunity to kind of help create their agendas for them based on what they're hearing in their communities, in their states, in their campaigns. And my favorite example of this is actually looking at the 2018 the class that was elected in 2018, came into Congress in 2019. And we kind of considered those freshmen the healthcare class. They were almost all elected coming off of the repeal and replace fight over the ACA in 2017. A lot of them won seats against members who had voted against the Affordable Care Act. And a lot of them, healthcare was so important in their election, was talked about constantly during their campaign. And a lot of them came into Congress and were really important healthcare champions. You know, you have Lauren Underwood, who was elected and has been really leading the effort on the Black maternal health crisis and the Momnibus bill that addresses some of the long-standing disparities we've seen in healthcare. There are members like Susan Wild that were really key voices to get prescription drug reform passed in the House. So you can see that the conversations and the tone that they have when they're running for these seats can really then set the agenda for what issues they look at once they're elected. So that's why we think now is just a really important moment to be having these conversations, to be getting the issue of oral health in front of already sitting members and potential new members. And if you go to the next slide, you know, I think in thinking through where we're talking about, the reality is there's really a lot of places where there's ripe opportunity to be talking to folks, either in incumbent races or especially in open seats. So looking at these two maps that I've put here, the first one on the left is the current Senate seats that are up for election this year. And as you can see, there's a race happening in nearly every state. And importantly, there's a lot of open seats at the moment. You know, California, Arizona, Utah, Michigan, Indiana, West Virginia, and Maryland. And as I mentioned, those Michigan and Maryland seats are especially important since those are where sitting champions on these issues were already. And so there's just a lot of opportunity in almost every state to be bringing this forward. And again, you know, this is something that we're talking to all folks about. I'll talk about this on the next slide a little bit, but really the goal is to be having this conversation regardless of the candidate. We want to be making sure that all candidates are champions on these issues. So on the Senate, we see that there's a lot of opportunity to be talking about this in every state. And then the map on the right is the House of Representatives. Just a reminder, all 435 seats are up this cycle, as they are every 2 years. So again, like this is really a conversation that can be had in every state, in every congressional district. And, you know, we know that the impact of oral health coverage goes down to every congressional district, goes down to every community. And so there's an opportunity to make a champion in every single one of those races. And then going to my last slide, kind of as I alluded to, election times can be tricky and they can be difficult. I think especially for C3 organizations, it can always be a little confusing or overwhelming on if this is something that you can really be engaging in. And, remember, we're always centering the issue. We're trying to create an environment where regardless of what candidate wins, they understand the importance and the stakes to improve oral health coverage in some capacity. We want to make sure that regardless of what a Congress looks like in 2025, that they are primed and prepared and motivated to address oral health coverage. So talking about why oral health is important in your state or your community is not necessarily an election activity. If you have any questions, like always talk to a lawyer, but we're talking about the issue of oral health coverage. We're not talking about the candidate themselves. And if you are a C4, then that obviously gives you more flexibility to be able to talk about the candidates themselves. But we're talking about improving oral health coverage in this moment. So that's all for me. Just, wanted to reiterate, Bianca's gonna, now that we have an understanding of the popularity of the issue and why this moment is so important, I think Bianca is gonna talk about how we can advocate through the summer and into the fall.
Awesome. Yeah, thank you, Bailey. And hi, everyone. I didn't introduce myself. So my name is Bianca Rogers. I'm a project manager at CareQuest Institute for Oral Health, where I primarily support this wonderful network. So I am now, to close out our presentation, I'm going to talk about a new election toolkit that we have developed. So Peter talked about the poll results. So we took all of that rich information, packaged them in a toolkit for you to use. And hopefully, after hearing from Bailey, you can see why there is a strong need for us to take action and to be active over this election season. So if we go to the next slide, please. So there are several ways in which you can take action and engage your candidates. And so, I'm going to go through a couple of the ways to do that. And in this toolkit, it's your guide to, which will include template language and the tools and resources you need to make it really easy for you to engage this election season. And so what you're seeing here are the ways to take action, and whether you take action, you can take action in one of these ways, you can take action in all of these ways, just hopefully not in none of these ways. And so we'll go over just briefly some tips and guidance to all of these different activities. So if we go to the next slide, please. So what do we want to do with candidates? Well, the first step is we want to be able to reach out to candidates. We want to brief them on the popularity of these dental coverage issues like we just learned about. And then ultimately, we want to encourage candidates to talk about this issue during their campaign trail. And we want to find out what is their stance on this and to hear from them, their positions on these different things. Clearly, it's clear that voters and constituents want this. And so we want to find out from them, what is their position on these different issues in Medicare, Medicaid, and for veterans. And so we've developed some one-pagers here. Obviously, we heard from Roy earlier about the importance of stories and pictures and photos. And so we want to partner with you to get those sort of local stories and images from your states and your experiences, and couple them with the information that we have to kind of customize your materials and such. So if we go into the next slide, please. So I want to talk about one of the first actions you can take, which is emailing your federal level candidates, so U.S. senators and House reps. We saw from Bailey that about 2/3 of our senators are in races. All of the House reps are in races. And so the first step is you want to find out who your candidates are and what their contact information. And so we recommend Ballotpedia. This is a resource that has quite comprehensive information on all the candidates. They have a sample ballot tool where you enter your address and it shows you what's on your ballot coming up this year in 2024. And so this is going to pull up who your candidates are, their websites, their social media, a little bit about them and their issues. And so what you'll want to do is find their official website and then look for a contact in that website. So an email, a form, a phone number. And so in this appendix, I've done the exercise myself. I'm in Illinois, so only my House reps are up for races. And I've included some screenshots of exactly how I found out who my two running mates are and where I found their contact information. We've given you a template email which highlights the poll results, and in this you can customize it. You can add information about your organization, your work, some state and local facts. And it basically, the ask is, what is your position on these different issues? And can I have a quick meeting with you to discuss these further? And so if you're meeting with your candidate, hopefully you learned from Roy earlier some tips to get ready. There are also some tips included in the toolkit, but you can also reach out to us and we can help you prepare some great talking points. A tip for there's going to be circumstances where your candidate may be your current sitting member of Congress. And so if that's the case and you have a contact, an email already established in that office, feel free to reach out to that contact directly. Perhaps you participated in a former Open Hill Day, and so you'll just want to reach out to that contact directly. It makes it a little bit easier. If we go to the next slide, please. Another action, so in addition to the Senate and House reps, we've built a tool for you to email the presidential candidates. And so this one you can directly access at our Take Action Center. You can customize the message by adding, like I said before, info on your org, your experience, etc. So this is going to go to both camps, to Donald Trump, former President Trump and current President Biden. And this is a great option. It's the quickest and easiest one. Realistically, we hope you've been energized by all the work here, but if it works best for you to only take action on one of these things, you don't have a lot of time, this is the one that you can take that is the quickest and easiest. So this is a good option for you. If we go to the next slide, please. Okay, posting on social media. So included in our toolkit are sample posts and graphics for X and Facebook. You can engage with candidates here directly by tagging their handles. And again, you can find that information either on the Ballotpedia or you can find it by Googling or searching. We have some wonderful graphics that were developed that you can attach to your messages. Usually graphics do perform better. And we also have some hashtags for you to use. We go to the next slide, please. Okay, putting out a press release. This is a great way to increase visibility of the poll results and your organization. We've created two options for you to choose from. One that's been written in a more conservative frame based on those messages, and one in a more progressive frame. And so you can think, what's best for your local audience, what's best for your organization, and tailor it to really meet your needs. We heard, earlier today from Maya with some really amazing practical tips and guidance on how to build relationship with reporters. So you might want to pick some snippets from these and talk to some of your local reporters and try it out and put some of those tips into action. And hopefully you feel a bit more comfortable after hearing from Maya on her, her point of view as a reporter herself. If you go to the next slide, please. So we are soon going to be in the middle of growing campaigning. So right now, currently the RNC is happening. In a couple of weeks, the DNC will be happening. Congress recess is coming up soon. And so more candidates are going to be out on the campaign trail, meaning they're going to be hosting events where they want to connect with their constituents. They want to connect with advocates, with you. And so one way to raise oral health as an issue is by attending the event and submitting an oral health question. And so we've developed a couple of questions that you can submit. So, when you find your candidates' websites, you can typically find their events on there, if you follow them on social, or if you, Roy talked about, signing up for their newsletter. And when you RSVP, you can typically submit a question, or when you're checking into the event, you could submit a question. And it's a really great way for, you to put this out in the world, and then also for the candidate to be talking about it, especially since we know how much strong support there is behind our issue this year. If you go to the next slide, please. And well, last but not least, we encourage you to spread the word, share this toolkit far. We want as many candidates engaged on this. We want as many advocates engaged on this. So there is some templated language that you can create a blurb for your newsletter, or send an email through your listservs, or just send a personal email. Or I don't know if Christian's on the line from Oregon, but he loves to share the open announcements on his LinkedIn. And so that's a great way to get more folks involved and activated this election season. Next slide, please. So when should you take action? This toolkit can be used throughout the election season up until election day, but there are certain dates that are more strategic. So for example, the week of August 5th, Congress is going into recess, and so the campaigning is going to pick up. So we highly encourage you to take action during this week. We are hosting office hours this week. I'm hosting office hours this week. You can sign up for a 15-minute slot. So there, I can help you navigate and find your candidate's info. If you need technical support with any of the tools or materials, you can sign up and I can assist you with that. If you have questions more related to lobbying, or what you can do as a 501c3, or if your organization is trying to think through their advocacy and election engagement strategy, make note of that when you sign up, because I'd love to pull in folks from our advocacy team and Bailey who can really help you in supporting those sort of policy level questions. Now, throughout the election season, there are going to be more times that are strategic. Things shift on a daily basis, weekly basis. So we can, we'll be reaching out to you when there are opportunities, and when, and of course, adding to the toolkit as needs, as we see needs. And so, we'll be reaching out, no worries. If we go to the next slide. So what do you do after you take action? So in order for us to really understand our impact and our collective impact, we need to know what you've done. And so we ask that you log your interaction. This is a form you fill out on the Take Action Center page, webpage. And ultimately, what we want to know is how many candidates did you engage, so the number of candidates, and then what actions did you complete? And so when should you fill this out? So you should fill this out after you take your last action. So for some folks, that's going to be, you know, if you're engaging with us the week of August 5th, and that works best with your, that's most practical with your schedule. And then you would fill the form out after August 5th. However, if your organization is, wants to do more election engagement, you know, each month, you know, you might put out a press release in a couple of weeks. You might do some posting on social media next month, you know, every month. And so for those folks, you would want to fill this out more in like towards the end of October. So after you've kind of finished utilizing this toolkit, so we can capture all of that information and share it back with you all so we can see, you know, across the map where we've been sharing these messages and what we've accomplished together. And if we go to the next slide, okay, so this is where you can go to find, you know, to email your presidential candidates. Like I said, we have that tool to download the toolkit and then to log your interaction. So it's this website here. And if we go on to the, I think that's actually my last slide. Josh. I think the next one is the appendix. Okay, yeah, so the appendix, this is where, I'm not going to go through it, but this is where I've included those screenshots of how to navigate and find your candidates on Ballotpedia, which it may sound intimidating right now, but it truly only takes about 5 minutes. With that, that's a wrap on my presentation. We're going to move to questions now. Josh, if you want to take down the slides. Oh, just showing you. Yeah, it's not too bad. Okay. All right, so I think I'm gonna start with a couple of questions for Peter, and then I have a question for Bailey. So Peter, there was more of a technical question around if folks want to do poll, you know, I think there's always interest to do polling like in your local community and get data on your community. So when should folks do that? And then, you know, how much does polling cost? Like if you were to work with a pollster, what is a ballpark cost of that? And maybe you can talk to how, you know, the more niche a population, what that means for cost and the challenges.
Yeah, so when you're looking at registered voters in most states, you know, states that have at least a couple million people, you're going to be looking at costs around $25K for a poll like this. It really depends on the quality of the sample, so it can be done less, but you get to the point where the sample's so skewed. These are fairly representative samples, so it's fairly good numbers, and for the national one we went with the YouGov sample because it has some brand value. If you're talking to somebody in politics, they go, okay, I see YouGov polls, I know that, trust that panel somewhat. It's as far as timing, it depends on how you're using it. You know, I think in advocacy we're often using this to guide our messaging or to guide what we're going to tell candidates. And so I think it's early polling is better because then you can use it. You know, candidates, the earlier you talk to them, the less committed they are to all the things they've already said in the past. So you have really more influence. And, you know, if this is an issue they haven't addressed, which I think that's probably true of a lot of candidates, you know, you might be, and you get to them early, they could look at this and say, hey, this is going to demonstrate that I am, you know, a more sensible candidate. You know, it could be a great thing for a candidate from one party to bring into the general to appeal to the other party, because so it's you know, right, you know, so an issue like this, it seems to me like the key time is right as the people are coming out of the primaries, but also earlier than that. You do a poll right before the election, you know, so much is baked, it's almost like not really as important, unless you're like a newspaper or something and reporting on what's going to happen next.
Thanks for that. And I think another question I have for you is, you know, you've been working with us on this issue for several years now, and you know, we have our polling has a lot of data, has a lot of information. We've done a lot of message testing. So, I think time with candidates is limited, attention spans are small. So like from your perspective, what's that one key thing? What's that one insight that people should be lifting up in these conversations if they have limited time?
I think that the logic of it, people pay into it, they deserve something out of it. We should cover people's whole bodies, including their mouth. That kind of thing is very important. And then there's the simple, your voters, whoever you happen to be talking to, your voters support this. You're in a rural district. These are rural voters. Rural voters are overwhelmingly for this. You're a Republican. Trump voters overwhelmingly support this. Republicans are, just talk to where they are, and give them room to agree with you. Sometimes we to just hit those couple of messages and then start to hear back from them, because we haven't answered almost any worry that people have. I mean, we've been working on this issue for a while.
Yeah, no, that's great. I have a couple questions for Bailey, and then if folks have questions, please add them either in the chat or the Q&A, and we can get to it as well. So, Bailey, I think a lot of the folks joining us today are with 501c3s. And so is there a sort of rule of thumb when it comes to talking to candidates, do they have to talk to candidates on both sides of the aisle, or what's the best practice there? What would you recommend?
Yeah, of course. I will preface this by saying I am not a lawyer, and if you have any specific questions, you should definitely always talk to one. However, having worked for organizations that operate in the C3 and the C4 space for about 8 years now, and being familiar with the interchange between the two, as a C3 organization, again, like centering it on the issues, and then to your point, Bianca, it's really important to be talking to all candidates who are running for office and not one of any particular political party. So if you're, sending out a fact sheet to, to Joe Biden, it's like also important to send a fact sheet to Donald Trump's campaign as well. So really just making sure that you're giving information and you're advocating equally to both candidates is the way to be legally safest.
Yeah, that makes sense. Well, you teed that up well with your example, because the way we actually built our template email for presidential candidates is when you send it, it goes to both camps. So in that action, you're covered, which is good. But definitely remember that when you engage with your senators and House reps as well. Okay, any other questions from folks? We have an opportunity if people also want to raise their hand and ask a live question, we could do that.
I will just quickly, there was one in the Q&A box about engaging when you lack representation in Congress, and as a DC,
yes, please take
who is
that one.
also disenfranchised, I understand that, or DC, I live in DC, not DC native, apologies, but as someone who lives in DC. I would note that, while Eleanor Holmes Norton isn't a voting member of Congress, she still has the ability to weigh in on things. And she's actually currently not a co-sponsor of the Medicare and Medicaid dental bills. So engaging with elected officials at the community levels, and even if you don't think that that member necessarily has a huge power on the legislative process, they can still be an important voice in things. So that's what I would add.
Awesome, thank you. Peter, just a small question here around how to reach you. Do you prefer if people call you or email you, or no preference?
Call, email, send a carrier pigeon, any of that works. Email's super easy for me because I spend way too much of my day on there.
Okay, perfect. Okay, any last minute questions? Okay, well, we will be around throughout this election season, so just reach out